Question 31. Which of the following is the most likely diagnosis? ATN, HHS, aneurysm, pyelopancreatitis. So this one's kind of all over the place. Like I said, this strategy doesn't work for every question. If I were to guess, though, it's looking like either renal or maybe GI. Don't spend too much time on it. It's not worth more than a couple seconds. A 65-year-old woman with a history of poorly controlled type 2 diabetes. Please note, anytime they say poorly controlled anything, type 2 diabetes presents to ED with fever, back pain, confusion for the past day. Her daughter reports that she's been increasingly lethargic and unable to keep down fluids. On exam, the patient is disoriented. CVA tenderness is noted on the left. That's always important. Always important to tell you about CVA tenderness. Fingerstick glucose reveals 265. So yeah, that poorly controlled checks out. BP is 84/52. That's pretty good. Respirators are 20. Temp is elevated and she's tacky. What's the diagnosis? Okay, please burn this in your brain. If you take nothing from this 88 question series, take this with you. If you have hypotension plus a temperature disturbance, either hyper or hypo, it's sepsis every time until proven otherwise. Having poorly controlled diabetes, lots of sugar, lots of fuel for the bacteria, also checks out with our sepsis. Unfortunately, sepsis is not an answer choice. So we should be looking for something that could cause sepsis. Can ATN cause sepsis? No, but sepsis could cause ATN, but that's not what's going on here. What about HHS? This could be where she's heading, but classically, HHS presents with like over 600 milligrams per deciliter on fingerstick glucose, and she's nowhere close to that. And there are other reasons for why she's lethargic and unable to keep anything down, right? Hypotension, fever, it's sepsis. So not HHS, not yet. What about a dissecting aneurysm? Could that cause hypotension? Absolutely. But would that explain a fever? No. Would it explain tachycardia? Yes, absolutely. Because again, as we go hypotensive, assuming there's nothing actually wrong with the heart's going to try to compensate. So increased cardiac output, increased heart rate, and stroke volume. So ruptured AAA just doesn't explain all of our vitals, and it definitely doesn't explain CVA tenderness. Pyelonephritis, absolutely. That can cause sepsis. Pyelo is an infection of the kidney, so it can cause sepsis. It would definitely cause CVA tenderness. So I'm pretty heavy on D, but I'm going to check the last one just in case. Pancreatitis, could that cause back pain? Yes, probably not CVA tenderness specifically. This is always a buzzword. And pancreatitis is not going to explain hypotension with a fever. So the correct answer here is D, pyelonephritis turned urosepsis.